Welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. My name is Kimani Hendricks. I'm Multimedia Communications Coordinator for the foundation, and today I am joined by Dr. Maryanna Klatt, Ph.D., who will be sharing information with us about combating isolation with mindfulness. I am going to turn it over to the doctor now, and we're so happy to have you. Please continue whenever you're ready.
Thank you very much, Kimani. It's really appreciated. We are very fortunate here at Ohio State to have gotten a grant from MS Focus for our second year in a row to provide a program in mindfulness called Mindfulness in Motion, which is a program that I created in 2004. And for the last 21 years, we have applied it to different populations, both patients and students and employees, bunch of different things. I'm a professor in the Department of Family and Community Medicine at the Ohio State University College of Medicine. But what I do on a day-to-day basis is I run a center for integrative health. And we have about 30 providers, 7 physicians, 4 acupuncturists, 14 massage therapists, chiropractic, a lot of yoga classes, mindfulness classes, qigong, tai chi. So that's what I do on a daily basis. But I'm here today to talk about a program sponsored by MS Focus that I think is so effective for persons with MS. So I'd like to share that with you today. Going to share my screen. Yes, great. It's working. So the topic of today is combating isolation with mindfulness. And it's interesting because this title, isolation is loneliness, is one of the biggest problems in America. And it is way beyond persons with MS. It's students, it's grandparents, it's parents, just isolation and feeling alone is not something that is unique. And so we're all in this together. And I'd just like to tell you some things about this program that can make a difference in isolation. So really, here's the question, who's not lonely? Because it is part of the human condition. But it can definitely be made worse when we're limited by physical or emotional challenges that come up with chronic disease. Actually, I read something recently how it's very important to grieve your physical changes in order to accept them, to accept the things that we cannot control, that we need to admit, well, this is sad that I've lost control of my legs or my arms or whatever of walking. That is a necessary component. And in preparation for this talk, that's something I came across that I think can have widespread impact for people that are aging, people suffering with chronic disease, a variety of things. But mindfulness is one attempt to help us all reframe our stress and limitations that can help us to be more resilient and offer a different way to deal with stress, the stress of disappointment, the stress of not being able to control things. So today, I'd just like to share some research that I've conducted and others have conducted with people with persons with MS, utilizing mindfulness and gentle yoga techniques. We've been successful, which I'm very humbled to be able to say, very excited about. And so I'd like to share this approach with you today. So as the director for integrative health, we offer, as I said, a bunch of different things. And the whole focus is not just about, we changed our name actually from the Center for Integrative Medicine to the Center for Integrative Health. And the reason for that was to change the focus from what medical things can we implement to cure something to what modalities can we utilize to help somebody be more healthy in terms of their whole human being, body, mind, and spirit. So all three of those things matter and are valued at our center, which I'm really proud of. We have some pillars that I think are really important. In order to have any center be strong, the leadership has to be strong, and we've got a great leadership team. Our clinical piece, very strong. We deal with a lot of patients who have MS, have many neurological problems. A lot of people are in chronic pain, and that's probably our number one thing that we deal with. We want to educate the future healthcare providers in how to care for the whole person, the body, mind, and spirit of each individual patient. We do research, which I think is very important to push science and knowledge forward. And then we have community classes, which are not everybody can access the center. So we have a lot of virtual classes. We have a lot of classes in different types of things where we don't have the actual provider. And so we try to cover all 5 of these pillars. So what are the risk factors for people with MS? Well, there's a lot. I mean, your disability level, that can make a difference. Fatigue is a huge thing, walking impairment, and none of this I need to be telling you. You know what these risk factors are. The fear of falling, actually falling, and pain. Okay, so those are the things that come along with an MS diagnosis. But what are the protective factors? Physical activity to whatever level you're able, self-efficacy, feeling like you are in control of some things and that you can do X. Social support is huge. Optimism, central, which optimism is hard for any of us to sustain, but that is so critical in moving forward into the future. And then also perception of health. So greater resilient, the more resilient you are, that is associated with better quality of life for individuals with MS. So building resilience can be important because it balances the risk and the protective factors in quality of life. Combating loneliness and MS care through connection and community programs. For anybody, I don't care who it is, social isolation lowers quality of life and increases perceived disability in individuals with MS, regardless of the disease severity. So I found that really interesting, that if you're more isolated, that can increase how you perceive how disabled you are. Factors like mobility, job loss, stigma, changes in your social roles contribute to loneliness, but addressing these can enhance patient outcomes through wellness programming and support networks. And that's what I do, is wellness programming that includes a support network. Healthcare providers have to recognize that isolation makes a difference, because this is not just for MS, individuals with MS. 39% of Americans, um, only that many feel closely connected. So the others feel isolated. And this issue can lead to significant health problems. So clinicians need to ask direct questions like, what is it that you enjoy? How do you spend your day? So that the clinician can understand the patient's emotional well-being. So loneliness in and of itself can cause serious health risks, and thus it needs to be addressed. And the provider is one person you can connect with through discussing your physical health with them and your emotional health and all the other things that come together to form a person's whole health. Very important to talk to your doctor about relapsing, remitting multiple sclerosis symptoms, because these differ from among individuals. Each person experiences MS differently, so it's important to communicate openly with your care team. And I mean, let's face it, it's hard sometimes to talk to our providers. But providing detailed descriptions of your symptoms, can help your doctor understand your experience. Like, your doctor may not know that a certain symptom is causing you to experience X. And by communicating that to your doctor and having the doctor respond can help determine the right treatment for you. So taking notes on the progression of your disease can help. Take note of the symptoms as they occur, or your phone by using simple language. You don't have to know the medical terminology, but it's very important to communicate openly with the care team to manage symptoms effectively. And it's important for your doctor to understand what your experience is, because your experience may not be the next patient's experience. So social isolation specifically experienced by individuals. So there is links between pain, disability, and social isolation. Over half of the participants in this particular study experienced intense social isolation. Pain intensity made a difference, disability severity, poor economic status, the longer you have been dealing with that disease, and then if you were female, those are all things that significantly increased the isolation risk. And so if you're in one of those categories, one of those buckets, I think that's something to take note of and think, I need to pay extra attention to not becoming isolated. So there is a need for targeted support addressing pain, disability, and the other barriers in MS care to reduce social isolation. It's really important. People who are severely impaired with MS, that's even harder for them. And for people that are severely impaired, isolation is linked to the mobility loss, dependence on careers, and reduced social participation. When there's a loss of identity and feelings of powerlessness, then people withdraw. And that's a natural response. I get that. I have a very good friend with severe MS who, I know it's a struggle for him to get out and participate. We do art together, and I know that's a struggle for him to do it, but everybody in that class really encourages him to do it. And we try so hard to not like treat him differently or increase his embarrassment that he can't like carry something because he walks with canes. So I just think it's very important to think about what kind of groups or what kind of hobbies do you have where you can target what are the situations that you can get yourself into targets psychosocial support because they can all help no matter what that thing is. It can help with identity, purpose, and connection. Identity, purpose, and connection is so important for all of us. And I think it can become even more important if you're struggling with chronic illness. So there's different types of complementary therapies used for patients with multiple sclerosis. They're called disease modifying agents. And patients see complementary and alternative approaches to supplement their traditional treatment, not as a curative thing, but to help them along the way. And we have a lot of these things, and I'm sure no matter what city you're in, that there are some things that are out there, some alternative modalities that patients can use to improve the outcomes. And by that, I mean the outcomes of moving through your day with purpose, positive identity, and connectedness. So the talk today was supposed to be on mindfulness, and that's what I do. So what is mindfulness and what's the difference between mindfulness and meditation? Everybody thinks they know this, but I don't think everybody does know this. So here's the definitions. And this is in simple language because I am a simple human being. Mindfulness is being in the moments of your life as they're happening. Now, that can be easy when you're in joyful moments of your life. It can be very difficult when you are in challenging moments of your life. So some people think, well, I don't want to be in the here and now. But here's the reality. We only go through life in the here and now. But the problem is most of us are thinking about things in the past and or really strategizing about the future or catastrophizing about the future, which is bad. And only living in the past is bad. I see there's a hand raised there. So Kimani, if you could read the question or have the people, in fact, please interrupt me at any point if you have questions.
Yeah, it's completely up to you. We normally would wait until you are finished with
Oh,
your
okay. That's
presentation.
fine.
It's up to you. It just let me know.
That's fine.
Okay,
But if
so
somebody had something to say, I just thought, whatever.
got it. Oh, okay. Michelle said it was an error, no problem. But
Oh,
anybody who does have questions or comments, again, we will address them at the end.
okay.
But feel free to put them in the chat or the Q&A in the meantime, or if you want to speak directly, you can always raise your hand, but we'll go into that
Yes.
later.
Great. Okay. Thank you. I just didn't want to not acknowledge somebody. Okay. So mindfulness is experiencing the moments of our lives. How does that relate to meditation? Nobody would run a marathon without training for it. That's an analogy. Meditation is to mindfulness like training is to running a marathon. Meditation is a way to train our attention to cultivate mindfulness. What does that mean? That means you practice meditation so that you can be mindful as we go through the moments of our lives. In meditation, the goal is not to empty our mind. So many people say, I can't meditate because I can't empty my head. Well, you're not supposed to be emptying your head because that's what our brain is supposed to do. But what we're supposed to do in meditation is to pay attention to what goes through your mind. Is it fear of the future? Is it fear of not being in control? It's to notice what you think about. So many people, and this, when I work with employees, so many people have like negative self-talk, like, oh, there's no way I'll ever be able to do this. So and so much more, so much better than me, blah, blah, blah. And it has nothing to do with what position that person holds. In fact, a lot of the people I work with are highly skilled physicians, nurses, who are doing really important things like all of us. So what people think about, it's important to notice it so that if it's a positive thing for you, you can keep it. And if it's not a positive thing for you, you can let go of it. So when a person meditates, when your mind wanders, you just notice what you're thinking about without judgment, take a moment to pause, and then reconnect with the actual physical here and now. So the goal in my mind is to take mindfulness into all the moments of our day, but it is not an easy thing. The thing about meditation, where people think they have to go somewhere separate to do that, that's fine. That's a great way to train. But we can all enhance our lives by bringing mindfulness into the minute by minute, hour by hour experience of our days. So my program is called Mindfulness in Motion. It's a multimodal approach. And when it says yoga there, it is very gentle yoga, could all be done from a chair. Mindfulness, how to get it into the moments of our lives. Personal reflection is a big part of it. Scientific evidence. People love the scientific evidence that we now have because of the functional MRI. Now, when people are doing mindfulness activities inside the MRI machine, we can see exactly which portion of the brain is activated, what the brain's doing, all those other things. So that has really moved the science forward. There's gentle music in the background of every weekly session, and there's community. And the community part for mindfulness in motion for persons with MS, I think, is so critical because it's a way to connect with others that are dealing with similar challenges and listen to how they have adapted, what they do, how they think about it. It, to me, the community piece is the most important of this, the most important piece for any of the mindfulness in motion sessions. So what to expect? We have 8 weeks in the original 8-week program. First, talking about how important it is to practice on a daily basis, even for a couple minutes. How important sleep, how to have mindful sleep. People in today's world, I think because they're so isolated, is related to this. People can't sleep, and then they feel like terrible the next day. So how do you get on top of that? What is your identity? What's your vision of self? How can we use breathing to relax ourselves? Mindful eating, mindful yoga, again, just very gentle stuff. Movement through balance, centering through sensation, clarity, and release, and then staying grounded in whatever your life looks like. So that's the original 8 weeks. And then for 6 months after that, we have weekly emails that go out as a reminder of different little practices. We have monthly refreshers that everybody's welcome to join. And then we have continued, we have a mobile app that comes with the original 8-week program that continues then for 6 months. So really, it's an 8-month program. Why does mindfulness meditation work? It works because it impacts multiple neural connections. There's all this evidence now that after weeks of doing this, well, this is after 31 days, so how many weeks is that? 4 weeks. There are changes in the large scale networks of the brain. So areas of the brain implicated in depression show changes in connectivity. So the other section of the brain that is very impacted is the amygdala, our fear center. And the amygdala gets smaller. There's reductions in that section of the brain so that fear doesn't overcome our day-to-day existence. It also impacts the myelin sheath so that different parts of the brain can communicate to each other faster. So 1 month of mindfulness meditation in this study, recent study, showed that it can effectively reorganize the brain circuitry. So I started here with just the core mindfulness and motion program. One of the biggest groups that I deliver to, and we've probably had a couple thousand people at this point, are healthcare professionals because they are so stressed out, so burned out. I thought it was important to deliver mindfulness to them, to teach them these strategies so that they could help patients. And that has turned out to be true. First responders, we deal with firefighters, people dealing with an EMS providers. We dealt with the Northeast Oregon, state of Oregon network staff. We're in many different hospitals across Ohio. We're in the Leahy Clinic in Boston. There was a group of nursing homes in Tasmania, which I didn't even know where Tasmania was. It's in Australia. That we did a study with the patient care associates, so like the nurses' aides. For patients, we have big programming for cancer survivors, patients who have MS, caregivers of African American Alzheimer's patients. Those are our patient groups that right now we deal with. We are going to expand to some other patient groups. We deal with city employees. We've got a contract with the city delivering the mindfulness, and then college students, because again, they're isolated and stressed out. Okay, so how did I get into this for persons with MS? I was training a group of 20 meditation teachers at University of Minnesota to teach the mindfulness and motion at that university. One of the ladies that was there, her husband has MS. And so she said, my husband has MS. They had 4 kids, really interrupts with our lives because of the way he thinks about this. Could I take the mindfulness and motion program and do it with his group? Because he was in a group of MS at their community center. So anyway, we did it. She took it to Duluth, Minnesota, and we did a study with 22 participants with people with all different types of MS. And we looked at stress, anxiety, depression, fatigue, and quality of life. So did it work? I wasn't sure if it would. I wasn't sure if the yoga would be too, even though it's so gentle, I didn't know. And it was the right level for people. So what were the significant changes? There was significant changes in physical functioning, both in their role and their physical functioning, in vitality and mental health, anxiety, depression, and positive affect were significantly impacted. Cognition and psychosocial subscales within this standardized test also really improved. observing, acting with awareness, non-judgment, and reactivity all really improved. And those were things that the mindfulness, I think, made a difference on. So the question, did it work? And the answer was yes. So our hypothesis was confirmed in this feasibility study that there were significant improvements in both physical and mental health for people with MS compared with studies using mindfulness interventions that were much more time intensive. So most of the mindfulness interventions are like 2 hours, 2.5 hours a week, and then an hour in between each daily for until the next meeting. Mine is not that way. It's 1 hour, and then the mindfulness practices are 3 to 5 minutes. And you're pushed one every day from the mobile app. So I think that that is a difference. We were featured on the cover of the International Journal of MS Care. I think that was maybe in 2019. But here were the important things here. And I just want to highlight this. Stress is considered a possible trigger for exacerbating MS and MS symptoms. So learning techniques that promote stress reduction is really important in dealing with the MS diagnosis and managing the prevalent mental health conditions of anxiety and depression that can come with it. Another prevalent, distressing, and disruptive symptom of MS is haphazard and intense levels of fatigue. How frustrating to not be able to control that. So how do you deal with that frustration of not being able to control that? That's one thing that mindfulness was helping with. So depression and fatigue, they have a negative effect on quality of life for people with MS. I mean, they would have a negative effect, quality of life for anybody, any patient, any of us. So there were positive results indicating the pragmatic resiliency skills of mindfulness training can be helpful in mitigating unpleasant and unpredictable mental and physical symptoms that are associated with the MS diagnosis. Let's face it, change. Nobody likes change. And if you don't know what change is coming, that's even more challenging. And that happens in MS. So anyway, I think we made some strides here. I went into the literature to look, how is it that yoga helps with symptom management in MS? And because it does, because it's crucial in maintaining quality of life. And this is another thing that people seek out as a complementary and alternative approach to dealing with the symptoms like pain, mental health, fatigue, spasticity, balance, bladder control, sexual function, and improve overall quality of life. So yoga makes a difference on its own, but I think the power of the multimodal approach of mindfulness in motion is its music, it's yoga, gentle yoga, mindfulness, reflection, and then the community. Okay. So how to utilize yoga as part of a mindfulness-based practice? Many studies have shown that incorporating gentle yoga into a mindfulness-based practice shows significant improvements of quality of life. And this study was individuals with MS, and they looked at these different outcomes: physical health, energy, emotional well-being, sexual health, overall quality of life. But a significant finding was found for an improved quality of life for both online and in-person participants using a mindfulness-based program with yoga. So mine is now a fully virtual program so that we can reach people nationwide. Actually, and in the last session, we had people from Europe. I mean, didn't matter. because virtually you can get on from anywhere. So other people have done studies that have shown when you combine gentle yoga with mindfulness, it can really make a difference in quality of life. How does it do that? I think it has to do with non-judgment, frustration at not being able to do something and not judging yourself and trying to accept that regarding your present condition. I'm not saying that's easy, but I think that is the key. This acceptance thing, there was a study that came out of Pittsburgh that used mindfulness, but they took out the focus on acceptance of wherever we all are, and they didn't get the results. Accepting oneself is key. So practicing awareness decreases our engagement with negative thinking and emotions. And when we can let go of some of those things, it can help with quality of life. And all of the programs that have to do with mindfulness usually include guided meditations, breath work, yoga movement, individual reflection, group discussion. And in my program, there's a lot of, you don't have to participate, but it's available group discussion. And then the consistent home practice is available through the mobile app. So that's good. Okay, so there's physical symptoms and then there's mental health symptoms, anxiety, stress, fatigue, pain. But studies show that mindfulness is a protective factor against those symptoms to increase quality of life over time. So when they looked at 23 different randomized controlled trial, they found that mindfulness interventions did reduce depressive symptoms, anxiety, stress, and pain, as well as a moderate effect on reducing fatigue at post-test. And then the results showed that those results, the reductions, were maintained at follow-up. So down the road, longitudinally. So that's good too. Fatigue, big problem. There's a lot of different chronic illnesses that cause fatigue, but mindfulness has showed promising results for fatigue symptom relief. And that's a good thing. And they think that the reason for that is that practicing mindfulness may help us in self-regulation and in attentional processes, meaning how much we pay attention to the fact that we're so exhausted, and that can improve concentration. So counteracting the fatigue through strengthening those functions. Okay, what helps? And I think that's where we need to go. Hope. That is the brain's secret weapon for resilience. Hope does not mean blind optimism. It's the choice to believe in better possibilities, even when we're struggling with stuff, because it rewires the brain just like mindfulness does, which helps us with decision-making and problem solving. It's a strategy. It's not like something we're born with. It drives goal setting and sparks new pathways when obstacles come our way. And here's the other cool thing. Hope is sustained by stories. Hearing redemption stories reminds us that we're not alone and that new endings are possible. So it's not like magic. It's like a muscle. The more we practice it, the stronger it gets. So, and all of the reason I bring up this research article is that this one showed, they already talked about these results, but they showed that the weekly homework of the mindfulness practice is very important. And that 6-month post-intervention found that the benefits remain significantly better, especially for fatigue, when you did the home practice. And regular booster sessions were really important. Both of those things I do. But I wanted to show you. So a couple of years ago, we got a grant, 2022, to develop a mobile app for people. We have specific tracks for whatever group it is. And every day, people are pushed out different 2 to 3 minute videos. They're on nature, they're on just different meditations, and they're on some gentle movements. And like we have different movement ones for cancer survivors, different ones for persons with MS. So it depends what track you're in, what group. Here's another idea that I wanted to bring up: green spaces, getting outside. I thought this was so interesting. Environments surrounded by concrete and cars are called lonely-genic environments and can worsen isolation. So spending some time in nature can ease loneliness. And when you get outside and you see other people, talk. Green spaces help people feel safer and more trusting. So, and also just exposing ourselves to nature can reduce stress and anxiety. And it didn't matter your age, your income, your education. It just made a difference. Studies show that 1 to 2 hours a week outside increases relief from loneliness by 69% in 4 months. That is a lot. Nature can help reduce stress, which in turn relieves stress-related symptoms like pain. So spending time with nature can help us in emotional regulation and recovery. And it doesn't have to be far. I have a sister who actually never goes out of her house, but she stands on her back porch and looks at her backyard. And for her, that is a healing space. So nature can be a part of our lives, and it offers a simple and powerful way to help us. So here is the program, Mindfulness in Motion. We're beginning another session September 17th to November 5th. It is already filled, but we're hoping maybe MS Focus would fund us for another year. We have 50 people on the wait list, but still scan the QR code here to learn more about the program and then to be placed on the wait list, so that in case we can deliver a whole other year, which we would love to do, that would be great, and you would be the first ones to get that, to be in that program, which would be wonderful. So scan that QR code if you're interested in that. But here's another thing, because we're filled, I wanted to give, we have a version of the app that is free, and you can access it down here if you have an Apple phone, or over here if you do Google Play. And it's a limited version of the more robust app, but it's still worth it because you can save favorite practices on there, whatever. And I can send this flyer to the MS focus group so that you guys can get it out to everybody. So just to kind of try to wrap up here a little bit, it's like the real voyage of discovery lies not in seeking new landscapes. It may not be finding a cure to the MS because it's chronic, but it's in having new eyes in how you view things. And honestly, I think this is important. I don't care what our situation is in life. It's to have the freedom to know that the way that we view something makes a difference. And what are some practices that help us have new eyes? Breathing stuff that you can do anytime, anywhere. I think that they make a difference. This one is diaphragmatic breathing. So just close your eyes here for a second. Take a deep breath in through your nose. Push your stomach, your belly out. And then slowly exhale through your lips. Let's do that one more time. Inhale through your nose. And as you do that, push your belly out as your diaphragm goes down. And then exhale slowly through your lips. And it's amazing. So open your eyes then. It's amazing how quickly that can bring on some relaxation for you. I also have a self-compassion exercise that I have to do every day. I just know myself. My mind goes to the negative too. So here's what I do. I've got a little card next to my bed, an index card. And here's what the index card says that I read in the morning. I'm enough. Being awake to joy today is enough. Finding joy is not the goal, but recognizing it when it happens is delicious. Tonight, the opportunity to do so is going to be gone. So it's up to me how I approach today. It's not about what gets done. I'm enough. But by bedtime, I've forgotten that message. So I have to read this. Whatever I accomplished or didn't today, it was enough. If I was awake to joy for one moment, it was enough. Who I was in the world today was enough. I'm enough no matter what. And when I do that morning practice, what did that take? 20 seconds to read? Or that evening practice before going to bed, I'm just a better human being. Just know myself. And it's giving yourself a dose of self-compassion, which is so worth it. So again, here's the QR code if you want to just get on the list, and then we'll contact you as soon as the next go around. And it's all free because of MS focus. So anyway, there you go. And that is what I have.
Nice.
Good.
Thank you
I
so
think we
much.
finished.
Yes, thank you so much, Dr. Klatt. That was an amazing resource, and I sincerely hope that for next year, God willing, we will be able to speak to you as soon as registration opens. So
Great.
that way, the people who are watching this or who will see it later will have the chance to, to join.
Mhm.
But I know that it's in high demand. How many of these are there a year? Is there just one a year for now?
No, no. So this past year we did, let me think here. I think this will be the fifth session, the fifth eight-week session. So,
Nice.
so we have found a way to do this for the amount that MS Focus gives us.
Mhm.
Um, this year was 5 times. So, yeah.
Oh, that's fantastic.
But
So
the,
that,
yeah.
yeah, that makes me feel even better to know that this is something that is done throughout the year. So it's
Oh,
like, hey,
yeah.
this the spring one, there's summer or
Yes.
there's autumn.
Yes.
So
We do
good.
it autumn, winter, and spring. hmm hmm
Perfect.
And I think in the winter and in the spring, we did both a noon session and a 5:30. I mean, it's Eastern time, but we try to do it so it works in any of the, Pacific time or Central time.
Got it. So I just wanted to let everybody who is joining on Zoom and Facebook know, if you want to ask a question or if you have a comment for Dr. Klatt, you can either use the raise hand feature in Zoom. It should be right at the bottom bar of your screen. And if you are on Facebook, you can just type your comment or question into the section below the live stream. We also have the Q&A and the chat in Zoom as well. So if you're more on the shy side and you prefer to type your question out so I can read it as
Yeah.
another shy person, that would be just fine too. Um, but I did want to just say thank you for clarifying the differences between meditation and
Mhm.
mindfulness because I know that I fall into the category of people who thought that it was
Yeah,
the same thing,
yeah,
or that, oh my God, I fail at this because I can't keep my mind clear. Like I've said that so many times, and now
uh-huh.
that I know it's the purpose is not to do that, I feel better.
Your brain is doing its job when it starts thinking about stuff. It's just important to notice what it is that you're thinking about.
Yes, that's true. Oh, good. We do have a question. I
Ugh,
think I see.
how do you navigate fatigue in the workplace? That I get it. I think you have to do whatever energy boosting activities that you know that you can handle, like not overcommitting so that you can retain your energy to do the things that are important to you. And if going to work is important for your livelihood, you may need to, cut out some things in the evening so that you can get enough rest and not be so exhausted during the work day. So I think it depends on for each person, what gives you energy, what drains your energy. Sometimes I think people don't recognize what drains their energy and then they end up committing to these things that in the end are not good for us. Um, so I think that's a great question because that's fatigue is such a hard one to get on top of. So it's almost like you have to be proactively plan for yourself to be as well rested as possible. And you can't control the whole thing, but you can control some pieces of it.
And
So I hope that's
that almost takes mindfulness too, to
right,
examine what drains
right,
you and what gives you energy.
right.
Wow.
Yes.
Yeah. It's all a full-time job, unfortunately.
It is not easy being in the here and now. People think that's easy. That sounds like such a duh. Oh my gosh, that is the hardest thing ever to stay there.
Yeah.
Yeah.
I agree. It's something that I even have to remind myself of, and I have not, history in my life at least has shown that I have not been very good at that. I am trying my best to remain in the now, especially when, certain things in life don't pan out as you would like
Yeah.
them to. And
Mhm.
so it's easy to say what if or what if. So
Mhm.
yeah, it is a big deal and it does take a lot, but it can be done.
It can be
And
done.
I'm glad for programs like these because it can also help you be more effective, obviously, when the program is done, when it's over.
Uh-huh. What I like is that it's really 8 months
Mhm.
because people get to keep the app and keep practicing, and people do. I've got data on how much practice people do. It's unbelievable.
You know, you mentioned a little bit about identity earlier on the
Mhm.
presentation, and I can think of so many stories wherein people were in crises because they feel like, or have felt, some people diagnosed with MS feel like they don't know who they are anymore because they
Of
feel like,
course,
okay, I know this is the same body, but it's not acting like the
but
same body. And so, what can you, I guess, suggest or offer to someone who may feel like I don't even know how to get back to myself? I feel like if I met me, I wouldn't know me.
I don't think I think it's that get back to myself because this is yourself now.
Mm.
So how do you find an identity in the present with the set of physical things that you're dealing with? And how do you work with those things to still have purpose in your life and not feel like the you that you knew is gone? And I agree with you. I think that would be the biggest challenge of living with MS. Not, and that's where that grieving is so important. It's ridiculous to think that somebody would not be sad about losing some physical function. And so to acknowledge that and be aware, yeah, this is hard. This is sad. And, but not stopping there, acknowledge that, and then go on by thinking, but that's not the total of who I am. Whole health is body, mind, and spirit. And so, how do I strengthen those things that I can control?
We have two questions that just popped into the chat. Michelle says, how do you balance the need for exercise to help with management of the disease? And then the obvious overheating in spite of cooling vests. The disease is driven by inflammation. Exercise brings about inflammation. It's a good question.
Yes. I just talked to a neurologist about this question. And when she works out at the gym, she sees some of her patients that have MS, and she worries about them getting overheated and worries about that increasing inflammation. So how do you balance that? So Michelle, that's a great question. And I think that's an individual answer by figuring it out for oneself, because I don't think there's a one size fits all. It's exercising to the extent to which you know is good for yourself, but not pushing yourself beyond where you should go, so that then there's more inflammation. But I agree that that is a challenge. How do you balance those two things? The need for exercise of movement, but then not having the movement increase the inflammation, increase the heat.
Well, you did mention gentle yoga,
Mhm.
which obviously can be done from the chair. There
Yes.
are ways of getting in your spiritual, physical, and mental
Oh, absolutely.
by participating in things such as that. Chair yoga, Tai Chi is
Mhm.
another one that's
Mhm.
very
Qigong.
relaxing because
Mhm.
that's, yes, it's all some flow
Mhm.
movement. So not all exercise requires,
No,
you won't be perspired with all exercise. So
well,
the,
you won't perspire on
well,
any
yeah,
of the exercises on our app. I guarantee you.
good, good.
But
And
I'm
for
hoping you'll feel more centered by just raising your arms, seated, exhaling as you put your arms down, those kind of things.
yeah, and
Coordinating movement with breath.
for those who don't know, if you are watching, we do have chair yoga classes and Tai Chi classes virtually
Great.
through Multiple Sclerosis Foundation at msfocus.org. If you go into the events tab, you'll see health and wellness classes, and you can sign up for those there. But you can also just watch on our YouTube channel. So if you type in Multiple Sclerosis Foundation, you'll find our adaptive chair yoga classes and
Great.
Tai Chi and gentle movement as well.
Mm.
I think there was one more question. Susie says, how has your research shown a decrease in having to take anti-anxiety medication? I've never had anxiety until I was diagnosed with MS.
Mhm. Uh, so I've never done research on that, but I can tell you from the research participants that mindfulness helps titrate the dose you need down, because you don't need as much maybe. And of I I totally understand why somebody might need anxiety medication, but from a diagnosis. But you want to be on the lowest dose um, that you need. And so other lifestyle things that you can do to keep that dose as low as possible would be great.
It looks like we have one hand raised, but it is Michelle again, and I'm not sure whether or not she had another thing to add, so I am going to unmute her as soon as I find her.
Ah,
There she is. Michelle, are you there? Think you can unmute if you are. Mm, I see your microphone is not muted, but I can't hear you. We need some kind of like Jeopardy music right now.
I got
Stop
some
that.
for you.
Uh,
Michelle, can you hear us?
I hear you. Just please forgive me that I've been having all kind of technical. You wouldn't believe it today. Just mm, mm.
Okay.
It's okay.
Can't technology. Oh my God. Mm. I don't even know how it did that. I was my cursor. I mean, the mouse wasn't even near it.
Oh,
It's weird. It's something. Okay, we got to. I gotta go.
okay.
Thank you.
No worries.
No worries, Michelle.
That is hilarious.
That is
I do not see any other questions, but
okay.
in the chat, I wanted to let people know if you have not seen it, our tech support whiz, Bavia dropped two links in our chat. So it was the link to our YouTube channel and then the link to our events tab where you can register for health and wellness classes if you would like. So that does bring us to the end of our time, unless Dr. Klatt, if you had anything more to add, closing remark.
Just um, having chronic illness is hard, but there are ways that you can deal with it. And keeping your social isolation as low as possible is one of those ways. So connect with others to do things that you enjoy.
I agree with that 100%. So if anyone has joined late and if you missed part of the conference, you can go to Multiple Sclerosis Foundation's Facebook page, and our live stream will show up at the top of our page once we close out here in Zoom. And it will also be available to watch on the Multiple Sclerosis Foundation's YouTube channel in about 2 weeks or so. So please do subscribe if you are not already and keep your eyes peeled on that. Our next conference will be Monday, the 25th at 5 p.m. Eastern Time with Dr. Susan Peyrovi, and she will be talking about nutrition and supplements for MS again. I believe this is a continuation because she had done this in part before. But either way, we're going to be happy to have her. And Dr. Klatt, we were really happy to have you. I'm excited about this program. Again,
I am
I
too.
can't wait to hear more about just what is uncovered in research as a result. And I hope that we can do this again next year and that everybody who is on here gets a chance to be a part of it.
Love to have you.
Yes.
Thank
Thank
you.
you all. Thank you all so much. Have a good day.